Hi, I'm Dr. Mohammad Rafi Sheikh, Senior Consultant Plastic and Reconstructive Surgeon at Aurora Hospitals, Dammaiguda. As a surgeon, I'm practicing since 19 years. Today we shall discuss about types of burn injuries, how we should manage the burn injuries, what are the problems with burn injuries, how reconstructive procedures are done in burn injuries.
What is a burn injury?
Any injury to the skin and surrounding structures or underlying structures is called as a burn injury. Usually, any burn injury is categorized based on the type of injury. Ante entavaraku kalindi, whether it is superficial or deep, surrounding involving structures involved or not. Based on that, we categorize burns into superficial, deep injuries. Usually, the main problem with burn injuries is the involvement of skin and surrounding structures.
What are the type of burns?
Burns are of different categories based on the nature of the injury. Usually, if burn injury is due to hot oil, water, any liquid injury, we call it as a scalds. Any injury due to fire accident or any blast injury, we call it as flame burns. Any injury due to any liquids, acid or corrosive liquids or alkaline liquids, we call it as chemical burns. Any injury due to radiation related injuries, we call radiation injuries. So based on the type of injury and nature of the injury, we categorize burns into different categories of injuries. కానీ రెగ్యులర్గా మన దగ్గరికి వచ్చే యూజువల్ బర్న్స్ ఆర్ ఎనీ లిక్విడ్స్ సచ్ యాజ్ హాట్ వాటర్, oil, any household liquids which are usually very commonly used in the kitchen, and fire accidents are very common injuries we tend to attend.
Degrees of burns.
There are different kinds of burns. We categorize burns based on the depth of involvement of the injury. If superficial skin is involved, we call it as a superficial burns. If deep layers of the skin is involved, we call it as a deep burn. If underlying structures below the skin, such as underlying muscles, tissue, fascia is involved, we call third-degree burn. If bone is also involved, we call it as a fourth-degree burn.
So first aid for burns.
Any burns case, maybe it is due to fire accident or due to chemical injury or any boil injury. First is we need to clean the area, because we usually apply with the local toothpaste, turmeric powder, coffee powder, inks usually apply చేసుకొస్తుంటారు any burn injury. We need to clean the wound with a clean tap water, or in the hospital setting we clean with a normal saline solution to make the wound visible. Second is fluid resuscitation. Initially, any burn causes a severe fluid loss. We need to manage by fluid resuscitation. Next is control of the infection. Any burn injury will lead to the loss of skin area. So every chance of infection is there. So we need to cover the infection first.
Hospital management of burns.
Burn management categorized usually into 3 stages. First stage is resuscitation. As burn causes major tissue loss, there is every chance of dehydration and fluid loss, every chance of temperature variation. First we treat the patient by resuscitation, that is called fluid resuscitation. The first 48 hours of burn management is very crucial, where we manage the fluid loss initially. Next area of interest is how we resurface the burn area. Third is, if there is any tissue loss, how we will replace the tissue, either by skin grafting or flap cover.
Skin grafting and reconstruction.
Any burn injury will lead to loss of skin tissue, which has to be replaced. Usually if there is any small degree burns, the skin is resurfaced on its own. But in huge loss of skin, we need to replace the skin with from the other source. Usually in any chemical burns or any scald injuries, we use artificial skin as a replacement method for small areas. If there is a huge loss, like deeper layers of the skin is involved, then we take the help of the skin from the other source of the body. Like we use the split thickness skin grafting, full thickness skin grafting is used. If there is a loss of tissue, assume there is, other than skin, there is a loss of muscle or underlying bone is lost, we take the help of the other tissues, other muscles, other bone as a replacement. That is called as flap surgery. So usually all these surgeries comes into scenario only to avoid the contractures which are very common in burn injuries. Burn leads to contractures. So in order to avoid contracture, we use split thickness or full thickness grafting or any flap surgery or contractures releases. All these surgeries are done only to treat these contractures.
Emotional psychological impact.
As everyone sees burn as an injury or burn as a wound, but underlying burn, there is a social trauma, because any burn will yield with a scar, a bad scar, which leads to a lot of psychosocial depression. So always they say burn is a social stigma. So from the day of injury, to the final treatment of the wound, we always take this aspect as a main priority to motivate the patient, to give him mental support, to give him a best cosmetic outcome.
Rehabilitation and recovery.
Post burn treatment, there is every chance of having a bad scars such as hypertrophic scars, keloid scars, contractures. In order to prevent that, we give rehabilitation therapy to most of our burns patients in the form of regular physiotherapy, pressure garments, scar management techniques with various type of ointments, silicone gel sheets, compressive garments. To conclude, burn injuries are preventable in many situations just by taking simple precautions which can save many lives. Simple precautions such as keeping children away from the kitchen, handling the gas very safely in the kitchen, avoiding loose clothes near firecrackers during Diwali, using electric safety measures, storing the chemicals properly, keeping the tight lids. And remember, early treatment saves skin, function, and a life. Plastic and reconstructive surgery is not just about appearance, it is all about restoring the function and giving a proper confidence to the patient, giving a dignity and a quality of life to the patient. If you and your loved ones experience any burns, please seek immediate medical attention and give them a proper care and avoid any unnecessary home remedies. Thank you for joining this session. I am Dr. Muhammad Rafi Sheikh, plastic and reconstructive surgeon. I hope this discussion helped you to understand burn injuries better than before. Stay safe, stay aware, and take care.